See an arrow pointing to the structure right there. You just follow there and see where it's pointing. Simply name the structure. Okay, this is an example right here. This arrow may move on this artery right there. You see it right there? The artery that accompany the greater occipital nerve. This arrow pointing to the greater occipital nerve. So I may cover this arrow, put this arrow right there. Which artery accompany greater occipital nerve? Occipital artery. It may go to this artery right there in the suboccipital triangle. Which artery is this one here? Vertebral artery. Or going to the nerve that's coming out from underneath the vertebral artery. Which nerve is this one here? Suboccipital nerve. Dorsal ramus of C1. Or is going to this nerve right there, which is the same nerve tagged right there. This is dorsal ramus of C2. If you put greater occipital nerve, it's okay, but greater occipital nerve actually, after C2 penetrating semispinalis cavities and getting to the scalp, become cutaneous there. There is called greater occipital nerve. But I take greater occipital nerve for C2 dorsal ramus. Okay, it may go on this muscle right there. And we have this muscle on the model here too. You see? This model going to be on the test. Excuse me. These are the 4 muscles in the suboccipital region. If it's going right there, rectus capitis posterior minor. If it's going right there, rectus capitis posterior major. Or here, inferior oblique or superior oblique. We also have greater occipital nerve here. While we are here, I may put the tag on this muscle right here. Which one is this one here? Rotator, brevis. If I put it on this one right there, could be rotator longus and could be multifidus, because the multifidus span between 2 to 4 vertebrae. Okay? I'm not going to put it right here because we don't have muscles in the thoracic region. We don't have muscles in this area, intertransversali. This muscle found in the cervical region and lumbar region. Maybe a couple of them down here, but not there. This muscle right there, multifidus lumbarum. Okay, this one right there, the lower part of the rectus spina. This one for the visceral. Quadratus lumbarum is not on the test. Now for the deep back muscles, I also can use these figures. You see right there? You see the arrow right there pointing to the obliquus inferior or rectus obliquus capitis inferior. I may put it on this muscle right there. What is this one here? Iliocostalus thoracis. If I put it down here, Iliocostalus lumbarum. If I put it right there, longissimus thoracis. If I put it on this muscle right there, you see these are muscles. I'm not going to say name the muscle. You just see an arrow there. Spinalis thoracis. Of this one right there,
serratus posterior.
Serratus posterior inferior. Okay, we go to this one here. If the tag right there is remain right there, what do you call it? These are the transversal spinalis that they span between 5 to 7 vertebrae. What do you call them? Semispinalis. Thoracic region, semispinalis thoracis. This muscle right there?
Cervicis.
Capitis.
Yeah.
Okay, the cervix is located deep to the capitis and doesn't show here. Cutaneous nerves. We don't have them on the models, but this figure showing the cutaneous nerves associated with the arm. Okay? The tag right here pointing to which nerve right there? This is one of the branches of the axillary. You cannot call it axillary nerve unless I put the tag on the axillary itself. This branch of the axillary, but has a name. Superior lateral brachial cutaneous nerve, or superior lateral cutaneous nerve of the arm. Okay? And this one right there, posterior brachial. On this one right there, intercostal brachial. The most medial one, medial brachial. And we have them on this side too. We have medial brachial and intercostal brachial. Intercostal brachial T2, medial brachial T1. We have posterior brachial right there. This is off of the radial. We have basilic vein here in this figure. We don't have them on the model. Anything not on the model, going to be on the figure. We have median cubital vein there. We have cephalic vein. We have lateral antebrachial, you see coming out. And we have the stub of it on the model too. Okay. And we have the branches of the medial antebrachial, posterior antebrachial. Okay, this is for the forearm. Again, we have cephalic vein. If you see the tag right there, cephalic vein. If you see the tag right there, basilic vein. This is in the forearm. The yellow fibers are branches of the medial antebrachial. Right here, you see, this is lateral antebrachial coming out from underneath the biceps. Of course, we have the deep fascia here. Deep brachial fascia, deep antebrachial fascia. This nerve is the dorsal antebrachial. You see them? They are very close to each other. This is dorsal coming from the radial. This is the continuation of the musculocutaneous. This figure we have, again, you see the tag right there? This one, if I put the tag on this one right there, that's the axillary nerve. Before breaking into muscular branches to the teres minor and deltoid, and also give the branch right there, which is tagged right now, is superior lateral brachial cutaneous. This is radial, in radial groove. And this branch is posterior brachial cutaneous nerve right there. And this branch right here is the cutaneous that's going down behind the forearm, posterior antebrachial. This figure is good for the deep radial after coming out from underneath the supinator that doesn't show very well here. It becomes, all these branches called the branches of the posterior and interosseous nerve. Deep radial become posterior interosseous nerve. And you can see superficial radial is tagged here too. This figure, we have model, so I may not use those figures. This model, if you see the tags tagging this muscle right here, what do you call it? Supraspinatus, if it's coming down here. If it's going on this muscle right here. This one. Teres minor. This one right there. Teres major. This one right there. Long head of the triceps. You see? If I put the tag right there. Levator scapula, if I put it right there. We have all of these. Splenius, capitis. If I put it on this muscle right there.
Rhomboid minor.
You see? Each station you will have one tag, and this tag is 5 point. If I put it on this one right there. Serratus posterior inferior. If I put it on this wide structure. Look at the muscle here. Which muscle is this one here? Latissimus dorsi. What do you call the flat tendon of it? Aponeurosis. Latissimus dorsi aponeurosis, or aponeurosis of latissimus dorsi. Okay. You see how easy it is? This model has the same thing. If I put the tag right there, if you want to be specific, lower fibers of the trapezius. If I put it right there, upper fibers of the trapezius. And this is very nice. Which muscle here? Spinotransversalis. This is the capitis part of it, splenus capitis. This one right there, levator scapula. You see, you will have some tags on the muscles. This arm, okay? If you see the tag on this structure right there, let's say this muscle. Every
Coracobrachialis.
coracobrachialis, if I put it on this one right there.
Biceps brachii.
Huh? Short head of the biceps. If I put it right there, long head of the biceps. Okay? If I put it on this nerve, anything yellow is nerve. Which nerve is this one here?
Musculocutaneous, maybe.
Ulnar. Which artery and veins accompany the ulna and the lower half of the arm?
Ulnar artery.
The vessels accompanying ulnar nerve in the lower arm going to be on the test today. You have to know, even for the short distance nerve that running with the vessels. This is superior ulnar collateral. Okay. You see this brachial artery accompanied by median nerve. And in the cubital fossa, the nerve is going to switch to the medial side of the brachial artery. Which artery is this one right here? Look at this on the ulnar side. Ulnar artery, this one? Radial. What accompany radial artery in the forearm? This nerve right there. Which nerve is this one here? You see, radial breaks into superficial and deep. This is superficial radial. If I tag it here, superficial radial. If I tag it here, it's superficial. These are branches of the superficial radial, dorsal digital branches. Now look at the radial artery. At the wrist, gonna give this superficial branch. This is the only superficial branch of the radial artery. Superficial palmar branch. That's going to get to the palm on the radial side to complete the superficial palmar arterial arch. Radial artery going to disappear passing through the anatomical stub box. What do you call it there if I tag it? Radial artery and anatomical snub box. Right here, just radial artery. And going to dive through the first dorsal neuritis. This dorsal neuritis could be tagged. You will have two tags on this side. You never know. Could be on this nerve right there. Which nerve is this one here? Median. And the other tag on this muscle right there. Only two tags in the front here. Which muscle is this one here?
Flexor digitorum superficialis. Oh, this is superficialis.
This is superficialis. This is flexor digitorum superficialis. This muscle is deep to the superficialis. What do you call it?
Profundus.
Profundus. Okay? Now, could be on this yellow structure, which is a nerve.
Ulnar.
Ulnar nerve. Could be on this red along with the ulnar nerve. What do you call this red structure? You have to know there are two veins running with this artery, vena cava tentii. This is ulnar artery, this is ulnar nerve. Okay, now, if it going to this branch of the ulnar nerve that going deep ulnar. This one is the superficial ulnar. Superficial ulnar breaks into one common, one proper, and innervating only one little muscle, palmaris brevis. If the tag going on this one, three questions in the palm. Could be this one. What do you call it? Abductor digitorum minimi. Could be this one. Flexor digitorum minimi. Could be this one here. Abductor pollicis brevis. Could be this one here. Flexor pollicis brevis. Could be on this muscle right here. adductor pollicis. Could be on both of this red and yellow in the palm. What do you call them? Nerve and vessels. Common. Palmar, digital nerve. Could be right there. After the common breaks into two branches, they call proper. Palmar, digital artery and nerve. Could be on this first worm-shaped muscle right there. What do you call it? First lumbrical. We have 4 lumbricals, 1, 2, 3, 4. You see, 3 questions at the palm could be on any of this. Could be on this superficial palmar arterial arch, and could be on the deep palmar arterial arch right there. So anywhere you see the arrow pointing, you have to name it. Could be on this muscle right there. What do you call it? Adductor pollicis. Okay, behind it, first dorsal analysis. So this web, we have adductor pollicis on the palmar side and first dorsal analysis in the back. Okay, could be on this muscle deep to the abductor pollicis. What do you call it? Opponents. Opponents. The same thing, we have opponents digiti minimi there. Okay, so you never know where the 3 questions gonna be, but gonna be artery, nerve, and muscle. Okay, could be deep to the palmar carpal ligament right here that continues to become extensor retinaculum. Now, deep to the palmar carpal ligament, we may tag radial artery. We may tag this tendon of the flexor carpi radialis, or this tendon of palmaris longus, ulnar artery, ulnar nerve, and tendon of flexor carpi ulnaris. Okay? These are branches of which nerve? In the back, that innervating the
Superficial radial.
lateral, 2/3 of the dorsum of the hand. Which one?
Superficial radial.
Superficial radial. If I put it on this nerve right there, on the ulnar side, innervate the medial 1/3 of the dorsum of the hand and 1.5 digit. What do you know with this nerve? No. Superficial ulna is on the palmar side. This is dorsal cutaneous branch of the ulna. Superficial radial, superficial ulna. To complete the innervation of the dorsum of the hand and the associated digit, 1.5 here, 3.5 here. This is dorsal cutaneous branch of the ulna, along with the superficial radial. What do you call this structure? Part of the deep antebrachial fascia, okay, holding the extensor tendons deep to it, and there are 6 tunnels deep to it there, extensor retinaculum. If I put it on this tendon right there, that go into the little digit, extensor digiti minimi. If I put it on this tendon right there, which tendon is this one? We have 2 extensor carpi radialis, brevis and longus. If it tag right there, brevis, tag right there, that's the longus. Right here, extensor pollicis longus tendon. Right here, extensor pollicis brevis. And this one, this tendon, you have to say tendon of abductor pollicis longus. Okay? So 2 questions in the back here, 3 here. In the back right here, you have to know the triceps, the 3 heads. Which head is this one here? Long head coming out of the axilla from the infragluteal tubercle. On both sides of the long head, we have quadrangular space, triangular space. What's coming out of the quadrangular space? Which vessels? Artery and the veins are missing here. Huh?
Posterior circumflex humeral.
Posterior humeral circumflex or posterior circumflex humeral vessels. And we have the major nerve right there running with the vessels. What do you call it?
Axillary.
Axillary. Okay, here you can call it axillary, but not the branches that innervating the skin. Branches of the axillary we have cutaneous branches. They're called superior lateral brachial cutaneous nerve, or superior lateral cutaneous nerves of the arm, either way, AKA. Which vessels are this coming out of the triangular space? Scapular circumflex. Which muscle is this one here? Which head of the triceps right there? I'm not going to put anything on the card, just number and you see an arrow. Which head of the triceps is this one?
Cut lateral.
Lateral head. You see, spiral or radial groove where you have the radial nerve along with the profunda brachivessels passing through, separating the origin of the lateral head from the medial head. That's medial head. This is long head, medial head, lateral head, all together, and so on the olecranon. Okay, this is the stub of which nerve is this one here that descends down behind the forearm superficially? It's coming from the radial. Can innervate the skin on the dorsal aspect of the forearm. What do you call it?
Superficial radial.
Posterior
Antibrachial.
antebrachial cutaneous nerve. Okay? This is the biceps, and this is brachialis muscle. You see this nerve here coming out from between the biceps and brachial. This is the stub of which cutaneous nerve? Gonna run with the cephalic vein. We saw them early on the figure. Lateral antebrachial cutaneous nerve. And this is stub of which nerve is right there? It doesn't show that running with the basilic vein deep in the arm. This nerve coming from the medial cord. From the medial cord just before the ulnar nerve coming as end of the medial cord, medial antebrachial. You have to know all of this by now because you have tests today. Okay, this one right there. Flat extensions of the main tendon of the biceps toward medial. Watch it out today on the test. You see? Biceptal aponeurosis going medially, not laterally, and covering the main tendon of the biceps, you see, from here to there. Brachial artery and median nerve. BAM, B-A-M. Watch it out today on the test. Okay. And we said this is radial artery, this is ulnar artery. Okay? Right here, if you see the tag on this swelling of the spinal cord down here, lumbar enlargement. On this swelling right here, cervical enlargement. On this nerve right here that takes origin from C1 to C5. Spinal accessory. Okay? If you see them on this rootlets right there, are they dorsal or ventral rootlets here?
Ventral.
This is ventral surface of the spinal cord, so you can see the ventral rootlets, which are the same as this. These are ventral, this is dorsal. These are the same. I'm going to use this model, or this one for two questions here. So ventral rootlets, ventral root. Dorsal rootlets, dorsal root, and dorsal root here. In between, we have dorsal root ganglia. After the ganglia laterally, the dorsal meet with the ventral. These are all sensory. This is muscular, making spinal nerve, very short. Spinal nerve coming out of the IVF, as you see it right here, coming out, breaks into dorsal and ventral rami. So with the tag right there, dorsal ramus, primary ramus. Tag right here, ventral primary ramus. Tag right there, dorsal root ganglia. You see, this one is the same as this one, cross section, but this one coming from the cervical, this with the vertebrae, this is without vertebrae. If you see the tag right there, on the toughest meningeal layer, dura mater. Okay, it's the same as right here. This is dura mater. Since we have the vertebrae here, vertebral foramen showing the epidural space. In the space, we have fatty tissue and venous plexus. epidural fat and epidural venous plexus. Okay, this is the dura mater. And inside, arachnoid membrane. The space between the arachnoid and the pia mater, this is the pia mater, attached to the surface of the spinal cord. At this time, we call it pia here. We call it arachnoid membrane right there. And the space, subarachnoid space. If you see it right there, what do you call it? What we have right there in the dorsal ganglia, sensory neurons. Pseudo-unipolar sensory neurons. And this pia mater extension between the lateral surface of the spinal cord to the inside of the dura, dentate ligament. Do we see dentate ligament here? We see them right there. All these are dentate ligament, the blue, and the orange are the dorsal root ganglia. Dentate ligament. We have 22 pairs of this, holding the spinal cord inside the dorsal sac. Okay, dorsal sac termination is right there. This is the cul-de-sac of the dorsal sac. It's two-level. Pia mater, this is conus medullaris of the spinal cord, the lower cone shape of the spinal cord. They terminate at L1 disc. The pia mater continues. You see the green right here. It's called what? If you see this arrow next week right there, what do you call it? Filum terminale interna. Why interna? Because we have filum terminale externa. But structurally, the interna only made a pia mater. Externa, all three meningeal layers. This is also called coccygeal ligament. Okay, we have part of the brachial plexus right there. The roots level, C5, 6, 7, 8, T1. The trunk level, upper, middle, lower trunk. We have the divisions, anterior, posterior, anterior, posterior, anterior, posterior, anterior. And we have the cords. If you see this tag right there, if I want tag, like in the axilla, we have 3 tags. Could be an artery and 2 other components of the brachial plexus. I may use this plexus to tag, brachial plexus component. If you see the tag right there, what do you call it?
Superior.
Superior trunk, right here. Inferior trunk. If I put it right there, medial cord, lateral cord, posterior cord. You see? We have it up to the cord level. Of course, each cord is going to give branches and then terminate into 2 branches. It doesn't show here. What else? This model. This artery is very critical. It's most likely tagged somewhere. Which artery is this one here? Vertebral. Which nerve is located inferior or deep to the vertebral artery, while vertebral artery passing superiorly over the dorsal arch of the atlas? C1 nerve. C1 nerve is going to break into dorsal ramus and ventral ramus under the artery. Dorsal ramus is called suboccipital nerve, and the ventral ramus is going to come in front, doesn't show here, become part of the cervical plexus. We have C2 dorsal root ganglia coming out dorsally too, between the arch of the atlas and the lamina of the axis. Also breaks into ventral ramus and dorsal ramus. Dorsal ramus of C2 going to become greater occipital nerve after innervating along with C1 all the suboccipital region muscles. Okay, if this nerve is tagged at the distant deep to the lower fibers of levator scapula, rhomboid minor and major, what do you call this nerve? Dorsoscapular nerve. Where is it coming from? For lecture. C5 root. C5 root. Okay, if you see it on this muscle right there, what do you call it? Supraspinatus. Okay, this one right there. Deltoid. You see the deltoid?
it
Take
is.
origin.
Had a
The
bad
posterior
idea.
head take origin from. Excuse me.
Could have asked. I didn't see what
Did you see the reaction?
Yeah.
It's pulling up. Huh? If you see the tag right there, what do you call it? Posterior head, right here, little head, this is anterior head. Okay, on this side, if you see this tag right there, pec major. On this one here, on this, either one of these nerves that they are located deep to the pec minor, innervating pec minor and then reaching pec major. What do you call them?
Medial pectoral.
Medial pectoral nerve, coming from the medial cord. We cannot see little pectoral nerve is coming out from here at this level. Got the pectoral triangle going to the pec major, and then send branch to the pec minor, either directly to the muscle or to the medial pectoral nerve to reach pec minor. We see the plexus here. Okay, you see the M that we have it. We don't have the M on this one here. This one stops at the cord level right there. So this is the M, this is musculocutaneous nerve, this is median, this is ulnar. Any other things? Did we cover everything? I think that's it. So your test gonna be on the thing that we went over. You will have 22 tags. 22 tags. Off of all this, if you review this tape, I will put this tape on blackboard.